Hello students, welcome back to my channel. Now in this video we will see parental route of drug administration. Route of administration other than the intestinal route are known as parenteral route. Here the drugs are directly delivered into the tissues or blood. So here parenteral means other than intestinal route is known as parenteral route. यहाँ पे जो ड्रग्स एडमिनिस्टर किए जाते हैं बॉडी में वो इंटेस्टाइन में नहीं जाते या फिर स्टमक में नहीं जाते, डायरेक्टली टिश्यूज में और ब्लड में जाता है. ओके, now advantages. Action is more rapid and predictable than oral administration. So here एक्शन यहाँ पे बहुत जल्दी होता है. जैसे ही हम लोग ड्रग एडमिनिस्ट्रेशन करते हैं बॉडी में वैसे ही वो एक्शन दिखाना शुरू करता है. एंड हियर इट इज प्रेडिक्टेबल देन द ओरल एडमिनिस्ट्रेशन. ओरल एडमिनिस्ट्रेशन में हम लोग प्रेडिक्ट नहीं कर सकते कि वो कब असर दिखाना शुरू करेगा, कितने टाइम में असर दिखाना शुरू करेगा. बट हियर द केस इज डिफरेंट. हियर वी कैन प्रेडिक्ट द टाइम ऑफ एक्शन. These routes can be employed in unconscious patient. Unconscious patient जो है या फिर जिनको vomiting है और else at the time of the surgery we can use this route. Gastric irritants can be given parenterally and therefore irritation to the gastrointestinal tract can be avoided. जो gastric irritant drugs है we can give it through parenteral route also because it cannot go to the GIT and hence irritation of the GI can be avoided. Okay, it can be used in patient with vomiting or those who cannot be swallowed. Okay, so this route can be useful in the patient who are undergoing vomiting or who cannot swallow the drug or medicines. Digestion by the gastric and intestinal juices and the first pass metabolism are avoided. So here the digestion in gastric and the intestinal juices. Some drugs are distracted by the gastric or the intestinal juices that can be avoided, and first pass metabolism in the liver that can also be avoided in this type of route. Now here comes the disadvantages. Injection may be painful. Sometimes the injection may be painful. It cannot be convenient for the patient. It is more expensive, less safe and inconvenient. Okay, it is more expensive. So oral से तो ज़्यादा ही expense होता है इस route का. Less safe in the sense some may cause nerve damage. Okay, and it is highly inconvenient route. Injuries to the nerves and other tissues में अगर okay जैसे कि मैंने आपको बताया injuries nerves को injury हो सकता है या फिर tissues को भी injury हो सकता है because of the needles of the injection. So different type of parenteral routes are injections, inhalations and transdermal route. Injections as you all know which includes needles. Inhalations includes the sprays. Okay, transdermal route is again here also comes injections that are given only to the upper layer of the skin. See here, this is intramuscular, this is intravenous and this is subcutaneous. Subcutaneous matlab just below the skin. Okay, just below the epidermis. Okay, and intravenous means the drug is injected into the veins. Okay, here see here blue color. And intramuscular means it is given in the skeletal muscles or the muscles of the body. See here yellow color. Now first we will see injections. Injections are given with the help of syringe and needles. Here the injections as you all know given with the syringe or needles. Intradermal is injected into the layers of the skin, raising a bulb. Example BCG vaccine. Test for allergy. Okay, here the drug is given into the rising layer of the skin, that is upper layer of the skin just below the epidermis. Okay, only a small quantity of drug can be administered and this may be painful. Okay, this can be one of the advantage of the injections or the parenteral route of drug administration. Okay, only small quantity can be given and it may be painful. Now next is subcutaneous injection. Here the drug is deposited in the subcutaneous tissue. Example insulin, heparin. Okay, subcutaneous injection means the injections are given or the drugs are deposited in the subcutaneous tissue. Okay, subcutaneous tissue means just below the skin. Okay, example insulin and heparin. As the tissue is less vascular, absorption is slow and larger uniform, making the drug long acting. यहाँ पे hepatic first pass metabolism जो है that is metabolism in liver that can be avoided. Disadvantages: irritant gases में enhanced pulmonary secretion should be avoided. Irritant gases जो है that is which are harmful for our body that can enhance the pulmonary secretion. वो pulmonary secretion को बढ़ा सकता है which may cause cough. Okay, drug particles may induce cough. Okay, so the particles can also have the ability to cause the cough. Now next, third, transdermal. Highly lipid-soluble drugs can be applied over the skin for slow and prolonged absorption. Example, nitroglycerin ointment in angina pectoris. Highly lipid-soluble drugs means जो highly fat-soluble drug है वो हम लोग upper layer of the skin apply कर सकते हैं, because upper layer of the skin is largely made up of lipid. So there is slow absorption. Slow absorption के वजह से क्या होता है, there will be prolonged or long absorption and the drug will act for longer period of time. Here is the example, that is nitroglycerin ointment in angina pectoris. So transdermal route includes adhesive units, injections, ionophoresis and jet injections. These are the delivery systems of the transdermal route. Now here are the advantages. Duration of the action is long, so there is prolonged action of the drug, provides constant plasma drug level. Here is the plasma drug level is constant. Patient compliance is good, so patient can be comfortable with this type of administration. Disadvantages: larger dose of the drug cannot be loaded into the system. So large amount of drug cannot be given here. Can cause irritation to the skin. Irritations to the skin can occur, and it is highly expensive method. Now last is the local or topical application. Here the drugs are drugs in the sense that is creams, ointment, powders or paste are applied onto the upper layer of the skin or the mucous membrane. Drugs can be applied on the skin for local action. Okay, this can be only used in the case of local infections or local injuries or allergies, and it includes the local area or local site of the body. Example is ointment, creams, gel, powders and paste. Drugs may also applied on the mucous membrane, as in the eyes, conjunctiva, ears and nose as ointment, drops and sprays. Okay, here it can also be applied to the mucus. So that's it for this video. Subscribe to my channel for more such videos which can make your pharmacology far better, and comment for the handwritten notes. Thank you.